Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, Ohio University Lancaster, and Lancaster Fairfield Community Action Recycling and Litter Prevention.
Hello, I'm Lisa Hooker, and welcome to Fairfield Today from Fairfield Medical Center. It is a beautiful day, and we are outside at the Tranquility Garden. And my first guest for today's show is Dr. Omar Al-Nouri. He has recently joined Fairfield Medical Center. Welcome, Doctor. We're glad to have you.
Thank you.
And welcome to Lancaster, Fairfield County, and to Fairfield Medical Center. Tell me what your specialty is.
I'm a vascular surgeon,
Okay.
Which means that I take care of blood vessels kind of all throughout the whole body. The only place I don't go is the heart, but everywhere else I take care of arteries and veins that will affect patients all throughout the body.
You've only been here a very short time, you told me.
3 days.
3 days. So what brought you to Fairfield Medical Center?
My training, I was in Chicago at the
Our winters aren't nearly as bad.
No, they're not. That's what I understand. It's another big pull for me to come.
There you go.
I trained at Loyola University in Chicago, and that's when I first met Dr. Manova. He actually is kind of a mentor of mine. He kind of got me into the field of vascular surgery.
Okay.
And ever since he left Loyola and started here at Fairfield, we've always been in constant contact. And he told me about a job opportunity, so I came down a couple years ago to investigate and see if this would be a place I would work at. And that's kind of how I settled here. Is kind of fell in love with the community. It reminds me of the community hospital that my father used to work at in Wisconsin. That's where I grew up. It was Wisconsin. He was an interventional cardiologist. And it has a very similar feel to it there, so that's why I kind of felt at home and comfortable here.
Well, that's great. We welcome you. And Dr. Manova, are you in practice with him, or you work with the hospital? How does that work?
So I'm a hospital. We are both hospital employees, but we're partners, and we work together.
Wonderful. You talked a little bit about where you went to school at Chicago and all that. What type of training is required to become a vascular surgeon, regardless of where folks like you might land?
It's a long road.
I'm sure it is.
So we'll decide after high school, you do college and medical school, and then I did 5 years of general surgery training, and then I followed that with a fellowship for 2 years in vascular surgery.
And was all that at Loyola for you?
Correct. General surgery and vascular was all at Loyola.
Okay. To explain a little bit about what conditions a patient might have to come see you. I know you talked about arteries and veins and vessels and those types of things, but what would be common ailments maybe that our audience today might be familiar with in case they or a family member, I may need to remember his name?
Yeah, sure. So we deal with blocked arteries, essentially, is a big part of what we do. We also treat veins as well. Veins can be blocked that we can open up. Patients, those pesky varicose veins, which can cause a lot of problems for swelling and discomfort. We can treat those as well. And like I said, we kind of go all throughout the body. So we treat the carotids, which is the major arteries that feed the brain.
And that's in the neck, right?
That's in the neck, correct. So sometimes patients might have blockages there, and that could be the cause of a stroke. So we treat stroke patients that have blockages there that are significant. Or a lot of times we treat that to prevent a stroke. And we have multiple ways of doing it. We can do it a minimally invasive way with just balloons and catheters. It's called endovascular. Or we do just a traditional open way. So we can do both.
Neck, and then my guess is I hear more about folks having leg and maybe feet trouble, foot trouble, as opposed to the arms. Is that more common, and why would that be?
Just the way that the vasculature is set up, they tend to have blockages in the legs more so than the arms. You still can have some blockages in the arms, but it's less likely. Usually it's in the legs. And so, like you said, a big part of what we do is called peripheral vascular disease, so blockages in the legs, and that could lead to pain or tiring in your calf when you walk, or you have constant pain in your feet, or you even develop to what's the worst situation is tissue loss, or what we call gangrene or sores, ulcers on the feet. So we treat that whole spectrum. And again, we do it in either a minimally invasive way, or we can do it with an open surgery with bypass.
Okay, so the open surgery and the minimally invasive, would you start with the minimally invasive and then graduate, or does it depend, I'm guessing maybe on the circumstance?
It depends on the circumstance. I think for the majority, the technology has gotten so good with endovascular, which is the minimally invasive, that we prefer to do that. it's much shorter recovery time for the patients. They're in the hospital in a shorter amount of time, and they're equivalent in terms of the results with the open. But sometimes we cannot do it with just a minimally invasive, so you have to do it open.
Okay. Given all that you've talked about with us today, is there something you specialize in, or is the vascular surgery the actual specialty that you're in?
Vascular surgery is the
Okay.
specialty, but within vascular surgery, we each have our different kind of interests or specialties. We also treat aneurysms, which is kind of a ballooning of the artery, and that can happen anywhere in the chest, in the abdomen, in the arms, legs. The major one we treat is in the abdomen or in the belly. It's called abdominal aortic aneurysm, or AAA, which is commonly referred to. We treat that, again, open or with the minimally invasive endovascular. My specific interests are treating complex or very difficult abdominal aortic surgery, either open or endovascular, as well as what's called thoracic outlet syndrome is something that I kind of is my specific interest.
And coming to Fairfield County, I guess any population would have any number of ailments that would, require any type of specialist, which is why Fairfield Medical Center is so broad in those things that they treat. My guess is we have our share of folks who need vascular surgeons.
Yes.
Okay.
Yes, there's a big need for vascular surgery here in Fairfield County, and even in the surrounding county. So that's what we're here to do, is provide services for Fairfield County and beyond. Whoever would like to come to Fairfield Medical Center, my partner and I, Dr. Manova, will treat. We're a 24/7 service, so anytime that we're
People don't
needed.
always get sick 8 to 5.
No, they don't. No, they don't. So whenever they need help, we are there, more than willing to help anyone that wants to come by.
How would someone schedule an appointment with you? And I guess before they would do that, if people are thinking, my legs hurt, or, oh, I forgot, so I have an aneurysm, or it's something I don't think about because it doesn't cause any trouble, what do they need to have a trouble, if you will, or can they just call and say, I'd like for you to maybe examine me and see if I'm at risk for things?
Yeah. Typically how it works is either, if they have a family member that might have an ailment and they were told from either their primary care physician that they might have an aneurysm or they have disease blockages in their legs or their neck, then they can just make a referral and call our office, and we'll get them in as soon as we can.
Wonderful. So you should start with your primary care physician and get a referral to Dr. Al-Nuri and his partner, Dr. Manova, all located here at Fairfield Medical Center. As we're wrapping up here today, Doctor, is there anything you like to do in your spare time? I know surgeons don't have a lot of that, but maybe you can tell us a little bit about some of the things you do enjoy since you are new to our community.
Sure. I do like a lot of outdoor activities. I know sometimes it's limited here in the winter time, as it was in Chicago, but I like to golf and play tennis and play basketball. I'm a big sports fan. Much to the chagrin, I think, of many people here, I'm a big Wisconsin Badger fan.
Well, we might kind of
so
figured that when you said Wisconsin,
correct.
even though a lot of us are Buckeye fans.
Yes.
So,
don't hold that against me.
We won't.
You never know. I could change my mind. I don't think so, but you never know. And then my wife and I just kind of like a lot of outdoor activities. So.
Wonderful. Well, that's great. Well, it's so nice to meet you. Welcome to Fairfield Medical Center. We appreciate your time today. And again, if you have need of a vascular surgeon, Dr. Manova, Dr. Al-Nuri, talk with your primary care physician, see what his or her referral might be, and then they'll set you up and get you where you need to be. We're going to take a break and be right back with Fairfield Today in just a couple of minutes.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
Welcome back to Fairfield Today from Fairfield Medical Center. I'm Lisa Hooker, and we thank you for joining us. My next guest today is Dr. Irving Rosenberg. He too is a new physician here at Fairfield Medical Center, so welcome to you as well. Not just to our medical center, but to our community. Tell us a little bit about what you do as a rheumatologist.
As a rheumatologist, we specialize in autoimmune diseases and conditions such as rheumatoid arthritis, lupus, degenerative types of arthritis. We also specialize in osteoporosis and some more chronic pain conditions such as fibromyalgia.
Oh, okay. How long have you been here?
I started here at the medical center about 2 weeks ago.
Okay, so you are new as well. And what brought you to our medical center and our community, doctor?
Well, what brought me here, I did a lot of my training in Columbus. So from a distance standpoint of proximity, it was an excellent location. But what really brought me to the medical center was, I believe, the first time I was on campus, I was amazed at the commitment that the staff and everyone on the campus had toward their patients, and that really touched me and left a very strong impression on me when I chose to come here and practice.
Well, that is so good to hear, and so many of the employees and physicians and staff members we have interviewed on Fairfield Today, they exhibit exactly the traits that you just said, and you can hear it when they talk about their job and how they work with patients and in the community. So I'm glad you were able to see that as well. So what type of background do you need to be a rheumatologist? Did you do your training in Central Ohio?
I did. So to be a rheumatologist, you complete an internship and a residency in internal medicine.
Okay.
And as part of my training, I'm board certified in internal medicine. And then in addition to that, you do a 2-year fellowship in rheumatology.
Okay.
And then you do your board certification for that, and you're able to practice.
Wonderful. So are you in practice with others in a group here or by yourself?
I'm joining a practice. Dr. Stephanie Ott is also a rheumatologist here, and I'm joining her practice.
Okay.
And, look forward to taking care of some patients.
Wonderful. So what types of conditions would a patient or maybe a family member of someone who might have need of your services, what types of things would they be maybe feeling or seeing that they would say, oh, maybe I need to go see Dr. Rosenberg?
That's an excellent question. It's also a very difficult question.
It's never easy, I've learned.
We treat a very wide variety of conditions. So it can range anywhere from skin rashes or skin lesions, joint pain, joint swelling. Oftentimes we get referrals to see patients for things as simple as profound fatigue.
Okay, and that's similar to the kind of the fibromyalgia symptoms, maybe?
Sometimes.
Sometimes?
Some of our more organic conditions, such as rheumatoid or lupus, can oftentimes present with just very profound fatigue.
Oh, okay.
That doesn't have any other explanation. And so we'll see and evaluate that patient for any sort of autoimmune diseases.
What is the difference between the arthritis that I'm guessing just about everybody gets as they age, and I believe rheumatoid arthritis, which is a more serious condition? Is there a difference between the two?
There is a difference between the two. That line is becoming more blurred as time goes on in research and our understanding of these conditions.
Are they both called rheumatoid arthritis, even though they may have different, I'll say, traits or characteristics?
They are not.
Okay.
So osteoarthritis is probably the most common type, and it's, to kind of simplify it, it's caused by degeneration or wear and tear use over time.
As we age.
Rheumatoid arthritis is more related to an autoimmune process.
Okay.
So there's something intrinsically that you didn't cause or anything that you did to have this happen to you, but it just happened, but it causes chronic inflammation of your joints, and it can affect the lungs and other parts of the body as well.
Sounds there would be some pain associated, maybe more than just the regular arthritis people would get as they grow older. Is it more painful?
I guess that depends on who you...
Well, that's probably true. That's probably true.
Some people can have very profound osteoarthritis that's extremely painful, and it's one of the things we do as rheumatologists is to help reassure our patients and talk with them and work with them over time to help them deal with the issues that they may encounter.
Okay.
from their osteoarthritis. Even though it's kind of a wear and tear type, it can be very debilitating.
Right.
But I guess generically speaking, yes, people with rheumatoid arthritis can present with very acute pain and inflammation and swelling, and go from pretty normal activity to complete bed rest.
Okay. You've mentioned lupus a few times, and I'm not familiar with that. What is lupus?
Awesome. An excellent question. Lupus is an autoimmune condition, which means, once again, there's nothing that a person did to cause this. It's something they're intrinsically born with.
Okay.
But basically, it causes inflammation. It can cause all kinds of problems and wreak havoc from head to toe. So you can develop rashes, you can develop joint pain, swelling, you can develop seizures, heart problems, and it's caused by antibodies that are formed in the blood.
Okay. And are your patients all ages, or do they tend to skew one age group or another?
Autoimmune conditions and inflammatory arthritis can affect people of any age.
Even youngsters?
Even youngsters.
Okay.
We do have children that can develop lupus and rheumatoid arthritis, and kind of, they categorize a little bit different, so we don't necessarily call it the same thing, but it's virtually the same conditions, but in children.
Okay. Do you belong to certain professional organizations that keep you up to date and things of that sort?
Yes, I am. So I'm a member of the American College of Physicians. I'm also a member of the American College of Rheumatology and American Medical Association.
Okay. Well, those would make perfect sense for you to belong to, and like so many other physicians I've chatted with, I know that there are continuing education requirements, so you stay up to date on the latest things, and I guess the wonderful mystery about medicine today is things are always changing, and there's always something new to learn and something new to stay up on, and my guess is your specialty is no different.
Absolutely. We have our own CME requirements, and then also being a rheumatologist, our specialty is evolving, I would argue, faster than almost any other specialty. It's every day there's new medications and therapies and new research that help us to kind of figure out what is causing some of these conditions in people. So it's very, very important for rheumatologists to stay up to date on any new research or any new therapies that are available.
I was just going to ask if you use medication solely. You mentioned therapies, surgery. Tell me what the therapies would involve. I think medications of various sorts, are pretty self-explanatory, but what would be a commonly implemented therapy for a patient?
So we use a wide variety of treatments, but the vast majority of what we do as rheumatologists is medication related.
Okay.
So we use a whole host of medications to treat, specific individual conditions, but we also work very closely with our orthopedic surgeons. Sometimes people do need surgeries and joint replacements and things of that nature. So we work very closely with them. We also work very closely with some of our vascular surgeons to help us to determine diagnoses, and then also if they need any sort of procedure to help improve their life.
Sure. We so appreciate you being with us today. Since you are new to our community, tell us a little bit about what you like to do in your free time. I understand you probably don't have a lot of that, but if you have a little bit of time to yourself, what do you enjoy?
I'm a huge sports fan, so I watch almost any type of sports, but I'm a huge Buckeye, Ohio State football fan.
I'm glad at least one of the two doctors today we got to be a Buckeye fan, so that worked out.
We also just recently had a son, so my wife and I have a 9-month-old son that we're being overjoyed with every day.
Absolutely.
As he grows and get to experience that is just completely amazing.
Wonderful. Well, congratulations to you, and again, welcome to Fairfield Medical Center and to our community. Dr. Irving Rosenberg is a new rheumatologist here at Fairfield Medical Center. We are pleased to welcome him not only to the hospital but to our community. We're going to take one more break and be right back to Fairfield Today.
So we're going to talk about how to properly fit your child with a helmet. First thing you want to do is take your child to the store with you. That way you can pick out a helmet that they like and that they'll actually wear, and you can make sure that it fits them appropriately. When you're choosing a helmet, first of all, you want to buy it new. You don't want to buy it used because you don't know the history of the helmet. So once you've chosen a helmet that your child likes, set it on their head and make sure that it is not too loose or too big. You don't want to buy a helmet that your child's going to grow into because then it's not going to fit. You want the helmet to be straight across. A good rule of thumb is 2 fingers between the eyebrow and the helmet. That is a good guideline to follow. You want this chin strap to be pretty tight. You don't want it so tight that it's choking them, but you want it tight enough that the helmet's not moving around a lot on their head. I always say to kids who come to see me in the emergency department, you fall off your bike and break your arm, we can fix it. If you break your leg, we can fix it. But if you hurt your head and damage your brain, we can't fix it. All right, why don't you hop on your bike and go for a ride, buddy?
Welcome back to Fairfield Today. I'm Lisa Hooker. Our next guest is Beth Bell from the Fairfield Medical Center Foundation. Beth, welcome. Glad to have you.
Thank you.
I don't think you've been a guest, at least since I've been doing this, so it's nice to welcome you. And I understand you are the personal and corporate gift advisor for the foundation.
Yes.
For here at the Medical Center. What does that mean you do?
Well, we do a lot of our special events through the golf outing and the wine tasting event that's coming up here in the next month. We do solicitations to corporations for sponsorships, so that's really where the corporate gift advisor comes into play. I have relationships with those corporations and businesses locally to be able to help support our causes. I also help with the Grateful Patient program, the Grateful Patient coordinator, and then we also do the special events as well. So.
Wonderful. Well, tell me a little bit about the Grateful Patient program. I've seen your marketing materials for it and have been acquainted with some of the folks you have highlighted. And I'm sure in our viewing audience there are any number of viewers who have benefited from any number of services here at Fairfield Medical Center. So what is the Grateful Patient program?
It's an opportunity for our patients to be able to say thank you and to be able to recognize a legendary caregiver. So as we know, I think, offer excellent care here within our facility, and I think it's important for patients and loved ones and family members to be able to recognize those legendary caregivers. And by making a contribution to the foundation, they're able to do so, and then they are recognized within our Grateful Patient Circle and become, one of our legendary givers. We also, through that program, through the employees, we're able to identify them in front of their peers, and that's important as well, to have their peers understand that they're doing great work right along their side of them, and we offer them a pin and a certificate. So it's great for team building and for spirit as well to be able to recognize them.
Absolutely. Some folks might be surprised to learn that the Fairfield Medical Center has its own foundation. There are several foundations across the community, of which yours is one. And I think a common misconception is, I have to give millions of dollars to participate as a foundation donor. Can you tell me a little bit about when folks express that, how you feel about that? Because I don't think that's necessarily accurate.
That is very much not accurate. We work very much through our community, to provide health care. And our goal, as a foundation, we just were established in 2003, so we're very new for a foundation, and it's very common for hospitals to have a nonprofit organization such as a foundation. We are the philanthropic arm to the hospital to be able to seek fundraising efforts to try to help further those programs and services that our patients need that wouldn't necessarily be provided without donations that we receive.
Right.
So we have a wide variety of ways to give and wide variations of amounts. It is not about the big dollars. It's whatever, from $20 to $100 to whatever they feel comfortable in giving and saying thank you. That's the important piece of it.
I am. It's good to know that, because there are a lot of, like I said, a lot of viewers, I'm sure, who are so appreciative, including my family, of the various services and positive results we have received here at Fairfield Medical Center from any number of caregivers, be they doctors or nurses or aides. You need everybody, top to bottom, to make the hospital, the medical center, run efficiently and effectively. So it's nice you have this, recognition program where patients get the say. It's not just necessary from the staff or the coworkers, but where patients can recognize those employees who have really helped them.
And what we do when we educate our employees is to make sure that they're aware that every single employee plays a role within that program. It's not so much those that are at the bedside, or not so much those that are providing direct patient care. In fact, our very first person that was recognized, she worked in our billing office and was a financial advisor. So the patients and the family members loved her, loved how she reached out, was reassuring that we can do anything we can to try to help them. So it's good to know that it's not necessarily those that are right at the bedside. Everybody here can make a difference.
Wonderful. Well, tell me about the wine tasting. That is one of those upcoming events that you are working with, and it is soon to be. So tell us a little bit about the where, the when, and how people can reserve their spot.
Our upcoming wine tasting event will be held on Thursday evening, September 25th, and it's 5:30 p.m. to 8:30 p.m. We host it at the Fisher Catholic Alumni Hall. So that's there on Route 37 by Fisher Catholic High School. It is a separate area, separate gymnasium, but our volunteers and our decorating committee does a fantastic job in trying to, give that gym a completely different look. So it's a lot of fun.
And what can people expect if they come? Obviously a wine tasting, there's going to be wine and probably some other refreshments, some food and things.
Yes, so the cost is $50 per person. We have 12 different wines that people are able to taste, and it's everything from the sweet whites to Chardonnays to your red blends to Cabernets to Merlots, a nice wide variety. Our chef, Jamie Brumball, does all of the food, and he loves that opportunity to be able to showcase his culinary talents.
And I have been the beneficiary of some of those culinary talents. He is a wonderful preparer of all kinds of food.
He is. So we even say, even if you're not a big wine drinker, it's still fun to come and taste.
Sure.
But even just come for the food because it is exceptional. We also host a silent and a live auction, so that's a big part of our fundraising efforts that evening. So there's always something for everyone there. That evening as well, we also have entertainment provided for Cynthia, who is the musical duo a lot of people know here locally. So it's a great evening.
Wonderful. And how do people make a reservation?
They can contact the foundation office at 687-8107. We also have it available through invitations and through the hospital here and on Facebook.
Wonderful. Beth, thank you so much for joining us today.
Thank you, Lisa.
Mark your calendar for Fairfield Medical Center Foundation's wine tasting, Thursday, September 25th at Fisher Catholic's Alumni Hall. And if you would like to make a reservation, 687-8107 is the number to reach Beth or any of her colleagues there at the foundation. We're going to talk a little bit with Donna Stalter right now. Donna, thank you for slipping in here at the very end as we wrap up today.
Thank you for having me.
Well, there's just a lot to talk about. We've had 4 people today. I think that's the most I've been asked to do, so it's been very exciting. I understand that you, not only being a public relations specialist here, you have assumed the title of Lancaster Rotary Club President.
I sure have.
Is that true? That is a big job as a former Rotarian myself and my husband as well.
Yes,
so
it's quite an honor, that's for sure.
That it is. Yeah. So tell me a little bit about Rotary and what you foresee this upcoming year of yours as president will look like.
Well, Rotary is a civic organization here in Lancaster. We have 2 clubs, which is wonderful. We have the Sherman Club and the Noon Club, which I'm a part of. And I can tell you right now, we have over 30,000 Rotary clubs worldwide. And they provide a variety of services and support to those in need. And I can tell you that 1.2 million Rotarians are around the world. And the Lancaster Noon Club and the Sherman Club is a part of that 1.2 million Rotarians.
Wow, and Rotary has been long a force for good in our community, both clubs and the various projects they have. What is the purpose of Rotary? Sometimes I think with the service clubs, people think, oh, you just get together and have your meetings or have lunch, but there usually, and there always is, a greater good to what these groups do, including Rotary.
There is, absolutely. They take an active role in the community. They're professional members that go above and beyond to help those in need. And a Rotary Club is very diverse, which I think is great. We all have all of our different talents and our ways to help the community. You never know what project we're going to take on. I know here recently we've done scholarship luncheon where we've handed out scholarships to scholarship recipients and students that are in need and prove that they're going to excel in the future. So that's exciting. And then we also have a dictionary project that we do for 3rd graders. We have an upcoming project where we're going to renovate the Lancaster downtown gazebo.
Oh, great!
Get it repainted and re-roofed, and looking forward to that. We're working with Steve Gayfield from the Lancaster Parks and Recreation to accomplish that task, and we're looking forward to it.
Okay.
Yes.
And is there a theme for Rotary? Do you get to pick a theme, or is it an international theme?
It's an international theme.
Okay.
It's called Light Up Rotary, which is awesome because when we...
That just fits your personality, Donna. It really does. It really does. And I mean that as a compliment.
Yes, yes. Gary Hong is our Rotary International president. He announced the theme, and everybody was so excited because, again, it's like lighting a candle, showing light to those that need it, and providing that support as much as we can, both locally and internationally.
In addition to the Force for Good that Fairfield Medical Center is in Rotary and these other organizations, your own foundation, you also partner with United Way. And we are soon to be coming up on United Way campaign season and the Community Care Day. And I understand Fairfield Medical Center plays a big role in that as well.
We sure do, yes. We are a partner with United Way, and we're going to be involved in Community Care Day. I do believe that's this coming September, which is next month, and it's just right around the corner.
Yes, it is. Tuesday, September 9th. There are many employers who make time for their employees to participate in Community Care Day. If you're to find out, talk to your employer, call United Way. If your employer does not, or if you're retired or between jobs and you're looking for some positive way to use your time, I'm sure Sherry Orlando and the good folks at United Way will be happy to put you to work.
Absolutely, yes. We have an article in our Monday morning newsletter for Fairfield Medical Center employees to be a part of it and to sign up and help and share their talents and help out as best as they can that day.
And there's a blood drive coming up. I know there's always a need for blood. That is on Thursday, September 11th, here at Fairfield Medical Center in the Assembly Room. If you're interested in that, you need to call Amy Reedy, and that would be at 687-8443.
Yes.
That need for blood year-round, isn't it, Donna?
It is. And during the summer months, it's even more crucial because we have a lot of accidents, unfortunately, trauma accidents with motorcycles and whatnot. So please give the gift of blood. You never know if you're going to be the one that will be on that other side needing blood.
Absolutely. With
Yes.
people taking vacations and busy with other things, sometimes regular givers miss their appointments, so someone needs to step in and fill that gap. So,
Absolutely.
Donna, thank you.
Thank you, Lisa.
Nice to see you, and so appreciate you being on the show today.
Yes, thanks for having me.
That's going to do it for this episode of Fairfield Today from Fairfield Medical Center. I'm Lisa Hooker, and we'll see you next time.
Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, Ohio University Lancaster, and Lancaster Fairfield Community Action Recycling and Litter Prevention.